Good afternoon, everybody. Welcome to our Monday afternoon press conference, 2:15. We will hear words from Mayor Brown, Deb Swanson from Grand Forks Public Health, from Dr. Josh Deere from Ultra Health System, Sue Sherrick from Northlands Rescue Mission, and Jamie Schumacher from the Grand Forks Senior Center. To get things, we'll have statements from all of those individuals, and then we'll open it up to a 15-minute Q&A. After the opening statement. So we'll get things started today with Mayor Brown.
Well, good afternoon, and thank you for staying informed. We hope everyone had a safe and healthy Easter weekend. I'm sure many of you felt the strain of broken holiday traditions and time physically away from family and friends. They say you need a rainy day occasionally so you appreciate the sunny days. Times like these make us feel fortunate for the great blessings bestowed upon us. Please know that in our trials and triumphs, good times and bad, we are all in this together, and we'll get through this together. Thank you to our religious community for their dedication to the health of their congregations and offering their services online over the past few weeks. The strong engagement from our religious organizations during this time has been truly remarkable, and remaining active in our faith communities is so critical now more than ever. My gratitude also goes out to the work of Altu that has been done in the past few months, and we owe a debt to all the healthcare workers on the front lines of this pandemic. Altu is such an important and collaborative institutional partner that serves not only Grand Forks, but northeastern North Dakota and parts of northwestern Minnesota. Their response has been tremendous, and we as a community need to do our part to support them. That's why we must continue practicing physical distancing. Grand Forks County is fortunate to have the lowest rate of positive cases per test in North Dakota, but we know that could change at any moment. Now is not the time to let your guard down. We must continue to take responsibility for the health of ourselves and our community by staying home and slowing the spread. Wearing a face covering when in public settings is now a CDC guideline. This is not a substitute for physical distancing measures, but an additional guideline to protect yourself and others. Our physical distancing measures in place in North Dakota are functionally equivalent to the shelter-in-place orders in other states. As Governor Burgum has said, we are taking an all-of-government approach. Our efforts are federally supported, state-led, and locally executed. We are following Governor Burgum's strong and data-driven leadership and are ready to act further at the local level if necessary. In addition to taking an all-of-government approach, we are taking an all-of-community approach. Today, we have on the panel Sue Sherrick from the Northlands Rescue Mission and Jamie Schumacher from the Grand Forks Senior Center to talk about all the great things they've been doing to ensure all individuals in Grand Forks have the resources and support they need during these difficult times. Their organizations are doing tremendous work, and Grand Forks is so lucky to have such an active and compassionate organizations serving the community during these times. You can find information on support and resources at grandforksgov.com/resources. Next, I encourage everyone to utilize the delivery, takeout, and curbside pickup options from our local businesses. We have cut the red tape, and businesses are being resilient and demonstrating the innovative mindset so apparent in Grand Forks. Our local businesses invest, volunteer, and donate to our community, and they are there for us in our time of need. It is now their time of need, and it is our duty to step up and support them. Lastly, the city continues to execute its mission to protect and serve. Essential services are being completed, and we are beginning to develop long-term financial and business development strategies to respond to these extraordinary circumstances. The Red River crested at 47.6 feet, and we continue to be alert and ready to react to changing and circumstances that move forward. We ask that you stay off the dike and levees for public safety reasons and continue to be vigilant and cautious with your personal property. Keep up the physical distancing. Make sure to stay socially connected. Stay home, stop the spread, and save lives. We're in this together. We'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor Brown. We'll now go to Deb Swanson from Grand Forks Public Health.
Good afternoon, everyone. Mayor Brown really reiterate many of the things that I wanted to say today to the residents of the Grand Forks community and all of Grand Forks County. But I do want to reiterate a few things that are really important. COVID-19 is a disease caused by a novel coronavirus, and our population doesn't have any experience with this in terms of immunity. So all of the things that were mentioned, from physical distancing to hand washing to minimizing your trips outside the home, are very, very important measures that each and every one of us needs to take, especially to protect those who are most vulnerable in our community. And I'm going to say a word about that in a moment. But I want to tell you a little bit about the work that we do at Grand Forks Public Health Department that also helps us to contain the spread of this disease. Our team is working on contact tracing, which helps us to find individuals who may have been exposed from those who have tested positive. This, along with quarantine and isolation, are the best tools that we have right now to contain the spread of this disease that is new to us. Testing is a very, very important aspect of this work as well. And testing has helped us to identify people who are contacts of individuals who may also be spreading the disease. But most importantly, we are learning a lot about this virus. And one of the things that we are learning is that there are many people who might have it but not know it and might be spreading it to others, which makes all those measures just that much more important. As a public health professional, I'm especially concerned about those who are most vulnerable among us, our residents of this community and all of Grand Forks County. Those include people who live in congregate settings like nursing homes, group homes, jails, homeless shelters, and correctional facilities. We really need to do everything that we can to protect them and also to protect the people that are providing care to those vulnerable individuals, along with people who have underlying health conditions and those who are elderly. We know they are the most susceptible, and everything that we do every day helps to protect them. We also need to protect our essential workers, such as public health and healthcare, behavioral health professionals, and public safety workers, as well as the employees who work in grocery stores and pharmacies and a whole host of other essential services. That's very, very important to ensuring that all of us stay safe and healthy. Today, we'll be hearing from some organizations who are providing that care in the community, and I hope they will be able to tell us about some of the things that they are doing to protect those who are most vulnerable in our community in responding to the threat of COVID-19. Thank you for your time, and I look forward to your questions.
Thank you, Deb. We'll now go to Altru Health System and Dr. Josh Deere.
Thanks. Welcome, and thanks for allowing Altru to continue to have a part in this forum. I hope you all had a great holiday weekend and opportunity to connect with your loved ones. As we focus on our vulnerable populations during today's briefing, I want to share an update on how Altru is working with community partners to care for these individuals. We have teamed up with nursing homes, assisted living, jail, and senior citizen centers, offering our resources to them. We understand the need to physically isolate this population for their safety. We'll continue to work with them for safe transport and care to and from our facilities, and even reaching out virtually to their facilities or physically going to their facilities to see them in those settings. It remains vital to the overall health of all patient populations right now to contact us with your regular concerns. If you have contacted your provider's office or called 911 prior to COVID, please do so now. We have our COVID hotline for those with COVID concerns or symptoms. Sick clinic remains open and operational at the Family Medicine Residency location. And we have the availability to see you virtually with regular clinic operations in the ER or specialty care. A reason why I bring this up as to why to connect to your providers at this time is there's a concern that's growing nationally that those needing urgent or emergent care may be staying at home due to fear or other reasons and not seeking that care. There are now reports of New York City, which is a little different than Grand Forks, as we all realize, but they have a spike in deaths related to not seeking care for cardiac concerns. We don't want this for our community. We don't want this for our population. Our EMS, ER, and specialty care teams continue to be there for you in times you need them the most. Heart attacks, strokes, and surgical emergencies don't realize that we're all dealing with the global pandemic of COVID. So our main concern is that you still realize that you can reach out to us and we'll keep you safe and treat you appropriately. We focus on maintaining our safe care environments by trying to separate the sick and well. And we thank you for our ability to continue to discuss and answer questions in this forum.
Thank you, Dr. Deere. Let's go next to Northlands Rescue Mission and Sue Scher.
Good afternoon, and thank you, Mr. Mayor, for the opportunity to be here today. Northlands Rescue Mission continues to be open, serving the homeless population and a population in need of food during this critical time. We currently have numbers in the 30s, and we are serving to this day homeless adults and also providing short-term hotel vouchers for homeless families in our community who present and need a place to stay. My husband said to me one day, "Don't you kind of feel like the manger in Bethlehem?" Because there are a lot of places who have said, "We're not taking anyone right now." And Northlands Rescue Mission will continue to take people who present at our door who are homeless in need of shelter, and to provide the resources to them to help them stabilize and get back on their feet. We are more than just a homeless shelter, though. We also provide meals to the community, and we continue to serve breakfast, lunch, and dinner to our in-house clients. And we are also providing takeout meals at noon and 5 p.m. for anyone in the community who wants to come and get a meal because you don't have enough food to eat. You don't have to provide any ID. You don't have to provide any source of income verification. If you need a meal, just come to the door and we will give you a meal for yourself. We are also doing food boxes, and we are doing those from the alleyway. And if people are in need and do not have transportation available, we are also getting food boxes delivered to people because food is critical and we need it. And for people who just can't get out, we want to make sure that the food can get to them. We also continue to do a pop-up food pantry, and our next food pantry will be on next Monday, and we will be out in the area of Dakota at 55th, which is out by the Walmart on Gateway Drive, providing a portable mobile food pantry for people in the community. We have simplified the process so you can just drive up and get your box of groceries, and limited our time with individuals so that we are trying to have as little contact as possible to do what we can to keep people safe, healthy, and fed. And we also continue to do the backpack program for kids in the middle of all of this. So we are delivering now every week over 750 bags of food to the main food service office, which they then disseminate out to the grade schools where kids are picking up their meals. So 750 kids still every week will get backpack meals to feed them. So thank you to the public who has helped support that and who continues to support us every day. And thank you to Altru and to Debbie Swanson and her staff, and to Mara Duran and her staff at Spectra Health, who have helped us put together a plan that would support us and our clients in the event that someone becomes sick, either with COVID or anything else, to prevent the spread of COVID through our facilities. So we have had a great partnership, and we hope to continue that.
Thank you, Sue. And we'll go now to Jamie Schumacher with the Grand Forks Senior Center.
Hi, thank you, Mayor Brown, for having me today. I would just like to talk a little bit about what we're doing right now. Of course, we've closed the senior center to the public, but we continue to meet our mission of helping keep older adults healthy and safe. Right now, I echo what Sue has said in that food is critical, so that we have become laser focused on feeding older adults. So first and foremost, we consider our most frail older adults, and those are homebound Meals on Wheels and Grand Forks Home Delivered Meals clients. We have about 175 clients on those programs right now. For many of those clients, we've switched our delivery method. Instead of going daily to deliver meals, we're now delivering 1 hot meal and 6 frozen meals a week, and that's to reduce contact between the senior and the volunteers. So those people absolutely continue to be a priority for us. And next, we started a meal drive-through service. This is something we have never done before. We're in week 5 of it now. So every weekday from 11:30 until 12:15, people can come here to the senior center. They stay in their vehicles. They come up, they roll down their windows. We get their name and their birth date, and then how many meals they need, and they pull forward. And then thank goodness for power windows, because people roll down their back seat window and then we place our meals in their back seat. So it is a no contact meal drive-through for people 60 and older. If the senior can't come, we're encouraging them to have family members, friends, neighbors come and pick up the meals for them. So this is a good hot meal every day. Tomorrow on our menu, we have lasagna, green beans, a salad, and fruit. So we have been seeing an average of about 190 people a day coming through our meal drive-through, and we will continue to do that. If our numbers go up, we will extend the amount of time. But I want to reassure people, don't be intimidated if you see a long line of cars. We have traffic control, and we can get people through very quickly. So don't be intimidated if there's a line. This was obviously a lot more meals than we had been making previously. So we partnered, and we will continue to partner with local restaurants to provide the entrees for us. Some of the entrees, some we're still making in-house, but we needed to scale quickly, and it seemed like a win-win-win situation for the restaurants who need the business, for us who need some help with staffing, and then for the seniors, of course, to be able to get those meals. We also have frozen meals that people can place an order for frozen meals and then pick them up in the drive-through. Again, this is for people 60 and older. If you are not able to drive and you don't know anyone who can pick them up for you, we can make arrangements to deliver those meals to you. You know, I echo the same thing that Deborah was saying about we are working with one of the most vulnerable populations. We want to keep them out of public as much as possible, and that includes the grocery stores. So if we can provide the meals for seniors, that's really what we're focused on. Finally, our resources department, our staff has gotten quite a bit smaller in this area. So they are working primarily with our rural seniors in Grand Forks and Nelson counties to get frozen meals out to these seniors. So they have that opportunity to stay out of the public as well and get the food that they need. So people have been asking us a lot, what do we need here at the senior center? Volunteers have been fantastic, and we're good on volunteers right now. We have gotten so many calls from people. We do ask, probably the biggest need that we have is that people continue to check on their older adult neighbors, family members, and friends. If you can think of someone from your church or someone you know, maybe that you used to work with and they've retired, reach out to them. As an agency, we can only do so much, so we need to care for one another. And then finally, I guess I didn't mention this, for the meal drive-through service, we are not accepting any donations of food or donations of payment when people come through that meal drive-through. We don't want any of the contact again. If people would like to make a donation for their meals, we encourage them to send a check to the senior center, and they can indicate memo on, or in the memo line, they can indicate meals. So while we're getting contributions for the meals, we are open to accepting any other monetary donations. We have seen a significant loss in our operating revenue because we've had to shut down so many of our programs and services. So if people would like to make a monetary gift, you can do that online at gfseniorcenter.org or by mailing a check-in.
Right. Thank you, Jamie. We'll now open it up to Q&A, and our first question we're going to take from the City of Grand Forks Facebook feed. This is a question for Deb Swanson. Deb, do you have any thoughts on why the numbers are lower in Grand Forks compared to other communities like Bismarck and Fargo? Is there a possibility that the bug that went through the community in January and February was potentially COVID before there was testing, and that there's actually some herd immunity in Grand Forks. Your thoughts on that?
Well, I knew this question would come up eventually because our numbers are lower in terms of the number of positive tests. There have been a lot of theories posited about that. I had not heard the one about already having herd immunity, but I've certainly heard lots of other ideas. I think that it's just a matter of time that we'll be able to look back and figure that out. What I hope will not happen is that will change. I'd like us to be able to look back on this time frame and say that we did everything we possibly could and that we made all the right decisions when they were the right decisions to be made. And therefore, I think that we were either lucky or we did all the right things. That's not to say that we aren't preparing for that situation to change, though. We know it can change. We know it happened quickly in some of the other communities of similar size, and we certainly are thinking of our colleagues in the other major cities in North Dakota that are experiencing a much larger number of cases than we are. And that's all I'll say, but I'll be willing to defer to Dr. Deer if he has anything else to say regarding that. I think our testing has been good. I think we're doing the right number of tests. We're doing all the contact tracing to find potential people, but I think there's a lot we don't know right now.
Dr. Deer.
I think that from a healthcare system standpoint and a local and state government standpoint, that we've really done a good job of preventing a lot of potential spread early on. There was a major youth hockey tournament that was going to be bringing 55 teams to town from all around the area that was canceled. I think that was the weekend of March 14th. We had a hockey game that was canceled that weekend. The students didn't come back to UND. Our schools subsequently shut down on both sides of the river. I think that the sheltering in place really has mitigated the spread, and people coming back from their wintering must have taken the self-quarantine fairly to heart and done a pretty good job, because we still have very limited to low community spread, and our health system, and like Deb was saying, the Department of Health, we're all ready for it and we feel prepared. But if we're prepared and it doesn't happen, I think that'll be a great story.
Thank you, Dr. Deer. We'll go to Mr. Joe Bowen from the Grand Forks Herald.
Yeah, hey there. So this is a question I had last week, but Deb, you were not here or not on the last one. There's a rumor that the NHL might try and have some games at the Ralph, but without any fans in the stands. From a public health perspective, would a game like that be safe?
I thought you would probably be back with that question this week.
Yeah.
I think a lot of things would have to change before that would be a safe thing to do in this community. We have to remember that right now we have a state health officer order that quarantines anyone from traveling from out of state to self-quarantine for 2 weeks. So that would mean players would have to be here for 2 weeks before they could even play. Certainly not having fans at a sports event helps, but there's a whole lot of people that are behind the scenes in making something like that happen. The last time I talked to Jody Hodgson at the Ralph, he hadn't been contacted by the NHL about the possibility of that happening. I understand it was a lot of conjecture on a lot of people's part, but I guess what I would say is that a lot has to change before that could be a possibility in Grand Forks.
Thank you, Deb. Looking at the media, again, use the hand raise function to ask questions. We'll go to Mr. Bowen again.
Yeah, hey there. So this is a question, I suppose, for Mike, but maybe if Todd is on this call as well. It seems like you guys, or at least city leaders, have been meeting with like businesses, nonprofits, that sort of thing pretty regularly. Have you met with any other type of non-governmental organization, or do you plan to meet with any other sort of organization like that, such as maybe a tenant group or a student organization or a labor union or something along those lines? You know, people who maybe have skin in the game economically, but they don't necessarily own or operate a business.
Yeah, we'll continue our listening sessions on Wednesdays, and that we'll set the agenda based on who would like to meet with us. So yes, that's a potential.
And we also have Mr. Phelan. I have opened your mic. Would you like to put an answer in this one as well?
I can add a little bit, John.
Go ahead.
Yes, as the mayor said, we're ongoing. I know people want to, look at re-engagement regarding the economy. We are meeting with our institutional partners like Altru, University of North Dakota, Grand Forks Air Force Base, and we have been engaging small business throughout our community. We will continue to do that, not only to meet, but to come up with an action plan so that we can be ready when the governor provides kind of an incremental opening for business, that we've engaged, we've strategized, we've come up with some action plans, and we will be ready to go because we will have been successful in this moment of ensuring that we have a public health way forward on this first.
And Mr. Phelan, while we have you on the line, our next question will be from the City of Grand Forks Facebook feed. Can Mayor Brown or Mr. Phelan speak to giving essential workers within the city hazard pay, and what is the cleaning process for public transportation vehicles?
I can answer that, John.
Go ahead, Todd.
We are not providing hazard pay for those that are on the front lines on behalf of City of Grand Forks, whether that's public safety folks or whether that's in public works or waterworks. So we continue to provide essential services, and we're really appreciative of all the dedicated public employees and all the great work that they're doing day to day. Regarding the second question, there's the operators have personal protection equipment when they operate in the bus. We are not taking fares at this time so that we don't have face-to-face contacts. When possible, we're using the back door to allow passengers to enter. And there's ongoing cleaning in the buses before the day starts, at the end of the day, and of course during the day regarding bus operations.
Thank you, Mr. Phelan. Our next question will come from KNOX and Mr. Ryan Cunningham.
Question for Mayor Brown and also for Deb Swanson. So this past weekend, Hope Church on their Facebook page said that, to paraphrase, they were somewhat talked out of having a driving parade for their congregation to get together to celebrate Easter. And they said that that was done by city officials. I'm not sure who or which city officials they talked with. Those types of things went on all over the country. Over in Crookston, they had a mass where people stayed in their cars. In St. Cloud, where they have a stay-at-home order from the governor, they had a church service in their cars. Can someone talk to why that was discouraged in Grand Forks this past weekend?
I can talk to that. That was my discussion with Pastor Paul and Pastor Mark. And the message from the healthcare is stay home, not stay in your car. And when people get out in their car, there could be an accident, there could be a healthcare event, there could be anything that would expose our first responders to unnecessary risk. So the message needs to be consistent, stay home. And I think I'm very pleased with the choice that they made, and I'm very grateful they did it. And that will continue to be our message until we're told that it's safe to do other things. But right now the message continues to be stay home, because the virus doesn't spread itself. We spread the virus. And so we need to be vigilant. And if you have to go out for food or for medical or for pharmacy, then you do the thing of physical distancing, covering your face and washing your hands for 20 seconds after you get home. So that was my request to them to cancel that.
If I can ask a follow-up question on that, and then I'll give back the time. In your opening statement, Mayor Brown, you said, please go out and support local businesses. Please order takeout food. Please order delivery. Car accidents can happen and other sorts of incidents can happen in those situations. Why the church service?
I think that this food is a necessity, and I think that pastors were very gracious to do online church services to connect their religious community. So I think you have to weigh benefits and risks, and I feel that supporting your local business during their time of need is relevant. But I also think that the unnecessary risk of being in your car for parades and things like that can contribute to the health risk in our community. So I'm very comfortable with my decision, and I stand by it.
Next question to Mr. Joe Bowen.
Hey there. So this is another Mike question. It seems like a lot of the executive orders you've been issuing have been not necessarily at the explicit request of businesses, but they've come out of some of those listening sessions you've been doing. Yeah. Have any non-business entities asked for help via an emergency order or another city action? And if so, have they received it?
No, if we had heard requests, I think we would have responded to those. But right now, we responded immediately to the ones because they had inventory that was going bad. It's a business and economic decision we have to support so that we can emerge stronger after this. So no, I haven't received other ones, but if they come forward, we'll consider those.
Thank you, Mayor. We have time for two more. Mr. Bowen.
Yeah, hey, this is a question for Josh here. If I heard you right, you said you're working with jails in the area. I'm going to go on the limb and guess one of them is Grand Forks County Correctional Center. What are you guys doing there?
Our residency programs actually had a long-standing relationship with the Grand Forks County Jail, and they've been providing services since I was a resident, which is greater than 10 years ago, we'll say. So it's been a while. So those services continue, and that group of physicians continues to offer their support to that location.
Thank you, Dr. Deere. Mr. Bowen, final question.
So I guess I'm curious, what does that look like then? I mean, are doctors going in and caring for inmates there? Like, I get that you have a program, but what does that program entail?
Yeah, so they physically went there once a week over the last several years, as I said. And now, obviously, we'll reach out virtually with any video capabilities that we have connected through the Grand Forks County Jail.
I could add that the Grand Forks Public Health Department employs nurses that work at the correctional facility as well, and they work very closely with the residents. And they have been making a lot of plans to ensure that they can quickly quarantine or isolate anybody who is symptomatic and make sure that they're not in the general population. And they've done a number of things within the facility to ensure the safety of everybody that is there, as well as everybody that works there.
Thank you, Deb, and thank you to members of the media for joining us this afternoon. And as we have done in the past, also want to say thank you to Jamie Schumacher from Grand Forks Senior Center, Sue Sherrick from Northlands Rescue Mission, Dr. Deere from All True, Deb Swanson from Grand Forks Public Health. But as we have done in the past, Mayor Brown with the final words.
Well, again, we're early in this pandemic. I would still encourage everyone to stay home, and it's a consistent message, and continue your physical distancing and your washing your hands and covering your face if you must go out. But again, the message is stay home. The virus doesn't spread itself, we spread it. And Grand Forks is very fortunate to have a low positive rate presently. Let's keep it that way so we can emerge stronger from this at the end. Thank you.
Thank you, Mayor Brown. Thank you to our panelists. Thank you to the media, and thank you for those watching online and on GFTV. Our news conference for the afternoon is now over. Thank you very much.